The subcommittee on professional and occupational licensing of the Regulated Industries Committee will come to order. We have three bills we're going to hear today, and we're going to start off by letting Representative Chastain tell us about his bill. That would be HB 1385.
Okay. Thank you, Mr. Chairman. Members of the committee, we have HB 1385 here today, LC 521044. And I also have Bryce Rawson with me today from the Insurance Commissioner's Office as well. He'll be answering some questions if I don't know them. If that's okay, Mr. Chairman. And HB 1385 is really what it is it's a department bill for the Insurance Commissioner's Office. It's a lot of cleanup. They've not had on the fire safety side of the office, they've not had any legislation or a lot of changes in the last few years. So this was kind of picking up with some of that. It creates a deputy commissioner of the safety fire position in the agency, which will take some of the burden off the state fire marshal and hopefully improve the efficiency and responsiveness for the state fire marshal. It also establishes a more consistent process for hearings across the agency. Those wishing to appeal a decision by the office must first request a hearing from the commissioner, and then if the decision is upheld, they can petition for review to the Superior Court of Fulton County. It provides oversight for deputized personnel to ensure the deputized local fire marshals and state inspectors are in compliance with the operation procedures. It modernizes fees and fines for not having to working smoke detectors in dwellings, and increases reinspection fees for manufacturer housing certificates. That hopefully will cut down on excessive re-inspections and using the OCI staff as quality control, and have talked to the manufactured housing folks as well who don't oppose that. And the bill has been endorsed by the State Firefighters Association of Georgia. That's really the main points of the bill, Mr. Chairman.
Members of the committee, questions? I hear none. You must have done an awfully good job.
Thank you.
Thank you.
Okay, appreciate it. Oh, do we need to do the amendment now?
I understand there is a substitute. Is it available?
No, Chairman, I just drafted it. It only lives currently in my head.
You want to tell us what it does?
On line 264, the bill grants the authority for probate courts to hear misdemeanor violations of Chapter 25. And there's just a small oversight. When we grant the authority of probate courts to hear misdemeanors, we provide certain authority to probate courts and certain under a certain condition. Specifically, probate courts can't have jury trials, and so the grant needs to exist under the condition that the individual being prosecuted in probate court waives the right to a jury trial. Historically, we've done that by adding a new code section, 15.9, under 15.930. There's 15.930.1 all the way through 9 that has added these kinds of powers to probate courts to hear certain offenses. So there's an amendment here that I have, if someone wants to make it, to add a 15.930.10, which grants the authority for probate courts to hear offenses under Title 25, provided that the defendant waives the right to a jury trial. And I can read that in if necessary.
Let's see if we can go with your explanation for the moment. There's no one signed up to speak on this. Committee members have indicated they have no further questions, so we're in a position to take a motion. Have a motion and a second. Now, will one of you members make the motion that we adopt the substitute as has been described by legal counsel? Have a motion and a second. Those in favor of that motion will say aye. Those opposed, no. We have adopted your amendment, and now on the main motion, all those in favor of do pass will say aye. Those opposed, no. The ayes have it, and your bill is passed by substitute. It'll be in the full committee at 2 o'clock.
Thank you. Appreciate it.
Thank you. All right. Do we have Chairman McDonald is here? If you want to come talk about House Bill 1428. Looks like it's rather voluminous.
Yes. Very easy. Mr. Chairman, committee members, I got House Bill 1428 LC 474059. Mr. Chairman, committee members, this is just a housekeeping bill that the professional land surveyors and engineers have brought before you. And all this does is allows them to retain some of the authorized incidental fees that they may receive from giving out these nice licenses that when you become an engineer or a professional surveyor that they're printed and they send them to you for your wall, and some other incidental things that they can retain. Back in 2022, the professional surveyors and licensed engineers, they moved out from under the Secretary of State's office and became part of the Pell's committee, and that's where they are now the overseers of this. And when they moved out, this code section did not come with that allows them to retain that. So all this does is allow that the professional licensed engineers, that they can do what every other board in the state is doing.
Thank you, sir. Members of the committee, you have questions? I hear none. We'll go to public comment, and we'll begin with Michael Sullivan.
Thank you, Mr. Chairman. Michael Sullivan, ACEC Georgia. We're the trade association for Georgia's engineering industry. I don't want to take up much of your time. The chairman did a great job explaining the bill. As he indicated, when we got out of the Secretary of State's office in 2022, we did not catch this particular provision, did not get copied over into our new code sections. When we became independent, we found out when the Governor's Office of Planning and Budget reallocated $300,000 that we were retaining, thinking that we were still subject to the legislation, the code sections in the Secretary of State's office, and that's when we initiated this effort to make sure that, as the chairman said, as we get treated just like all the other licensure boards that retain these funds for their operations. I do, since y'all were the committee that helped us get out of the Secretary of State's office, I did want to give a little progress report. Great software. Our software works great. Our licensees love it. We have seen our complaints go from 0, which is what it was the year that we left the Secretary of State's office, because basically folks weren't filing complaints because they didn't think anything was going to happen. We went up to 23, 46, and 87. Which means that the word is getting out, that things are happening and those things are being pursued. But the one I really wanted to share with you is I had a board member whose daughter moved here from another state. She applied to get a license by comedy. It was approved in 3 hours. That's all I have, Mr. Chairman, but I'd be happy to answer any questions if anybody's got any.
Members of the committee have questions for Mr. Sullivan? I hear none. Thank you so much for those comments.
Sir, Mr. Chairman.
That completes public comment. Members, we're in a position to take a motion. Have a motion to pass in a second. All those in favor say aye. Those opposed, no. Your bill will be in the big committee at 2 o'clock today.
Thank you, Mr. Chairman. Thanks, committee. Appreciate you.
We're looking for Chairman Leverett. somebody has his phone number. Could we find out where he is? Let's see. We'll stand at ease until we get a report back. We understand Chairman Leverett is on the way. For those that haven't noticed, Chairman Leverett has arrived. We're going to let you catch your breath, and as soon as you do, we're going to let you talk to us about House Bill 1446 and give us, do you have a copy of the most recent sub?
I do, yes, sir.
Give us that LC number to make sure we all on the right track.
Chairman, it's LC 60-0331S.
Thank you. Got it.
And my apologies for being late. I had to make a vote in judiciary, so I left as soon as we were over.
It's that point in the session.
Yes, sir. Yes, sir. Well, Mr. Chairman, thank y'all and the members of the committee for hearing House Bill 1446. This is a bill that is extremely long, but to distill it down, it basically would take this current state EMS department, which is in the Department of Public Health. It would move it up under a council or a board that would be appointed by the governor, and it would then administratively attach that council to the Department of Community Health. So it's taking it out of DPH, putting it in DCH. The reason for that is DCH currently pays ambulance services when they have Medicaid fares, and it's believed DCH would be a better fit for EMS service than DPH currently is. And we also are trying to do a board, because that's something like some of the other emergency professions like firefighters and so forth have their own board, and it's just believed that would give the people who actually perform the service and are familiar with the manner in which services have to be performed, emergency medical services be performed, more of a direct say in the licensing, the training, the certification of those professionals. And that's basically the bill. The rest of it, even though there's a lot of new language there, some of it relates to the board and the transfer of authority from DPH to this new board. The idea is that there would be no change in personnel. Everyone who currently works in the state office of EMS at DPH would then just work under the new board. And then it's simply about taking existing code sections and tweaking them so they refer to this new council or board. I've used the term board, but it's actually would be called the council. And transferring all the rights, duties, powers, obligations, contracts, what have you, from DPH to this new council. And then there are the other EMS-related functions at the state office under DPH would also transfer. So designation of trauma care centers and such as that. Much of the bill where it shows new language is actually existing code sections just retooled to reference the new council and to move into the appropriate code section ranking where they are in terms of the listing of them, because we're adding code sections to create that new council. So that is certainly a new policy change that we're proposing to implement, but otherwise we're not proposing to implement any substantive change in the way ambulance zones are determined, in the process for the RIMSACs, the regional EMS councils, to recommend those zones. We did have a provision in the initial bill as filed that said that would be done annually, which anyone knows that process is extremely stressful and significant for folks, and so we struck that language because the idea was not to have to dig that up every year. It's just at such times as the council determines it. And we tried to do some other cleanup with the substitute, and I think I've got my email. I could discuss the changes if you like, Mr. Chairman, but it's all within the general scope of simply just moving EMS, state EMS office, and moving EMS services under a appointed board or council.
Thank you. Let's see if our members have any questions. Members? If you don't, yes, we do have a couple. Who is 22? Is that Representative Draper?
What's the impetus for the bill? What is the impetus for the bill? Who's asked you to do this and why?
Well, my local EMA director, the first year I was elected, he had me come to his office for a meeting, and I think half of the state EMS directors were there. They wanted some kind of change. At that time, there was some discontent with the particular state director. That personnel has changed. They no longer feel that way toward the office and the personnel in it, but they still feel it would benefit the delivery of EMS service if the body that was making the rules and the regs was populated with people who actually have done it. And so that's it. So that this is not just an Elbert County initiative. It is one that I understand is fairly broadly supported statewide, at least among public EMS services.
I might mention that what Representative Draper asked would commonly be asked as, where's the clamor?
Yes, sir.
Okay, who's 26? Chairman McDonald.
Hello, thank you, Mr. Chairman. Isn't it true that this new bill will also bring our testing back to Georgia, where it's been on a national level, that we'll start doing our own testing with our own, creating our own medics by EMTs, paramedics, and we'll do our testing back in Georgia, which I think is a benefit to Georgia because we know our people, we know what it takes to run EMS in the state of Georgia, not California, and not Washington State.
I believe that is the case, yes, sir.
Thank you. If I might, and I bet you can do this fairly quickly, tell me what the powers of the new council is.
Well, it would have rulemaking authority, so it could issue regs subject to the Administrative Procedures Act. It could contract. It could designate a licensing official, just as the current state EMS office, DPH, does through that office. The council would do that. It would basically have all the powers that the Department of Public Health has, and it's through its EMS, State Office of EMS, and would provide all those functions.
Thank you, sir. We have more questions. Representative Smith is recognized for a question.
Thank you, Mr. Chairman. Have you spoken to the governor's office about this bill, and is there any known opposition?
I'm not aware of any opposition. I would say Department of Community Health is somewhat apprehensive about taking on EMS this year, to be fair. I think that is what they've told me. And they also were, I think, wanted to mention that assigning this entity to them administratively would have some physical impact on our office, because the council would then be using their legal staff primarily, but also their IT, HR, and that sort of thing. So that they haven't given me any numbers, but that would be something we need to deal with through an appropriations process. My assumption is it would have a similar relieving impact at DPH, so it wouldn't be a net addition to the budget. It'd be a matter of just shifting things around. But I don't know that for sure. Frankly, I haven't even gotten that far with them yet. But and I've discussed with officials with DPH about it, and I don't sense there's any opposition on their part. I think their view is that they understand we make that policy and they'll comply with it.
Thank you, sir. Representative Draper is recognized for a question. She waves. All right, let's go to public comment. Kim Littleton.
Would you like me to move, or do I keep?
No, why don't you stay right there,
Okay.
because we might ask you questions about the public comment.
Mr. Chairman, members of the committee, thank you very much. My name is Kim Littleton, and I serve as Executive Director of the Georgia EMS Association. The association represents the EMS providers, educators, service directors, and medical directors of the state. Representative Leverett, thank you for bringing attention to this issue in the EMS profession. We certainly, our professionals function under the regulatory authority and oversight of the State Office of EMS and Trauma and the Department of Public Health. And we certainly want to continue ongoing conversations in however this plays out. But one of the things I feel like that our membership right now is in agreement that we should certainly have these ongoing conversations to address the issues that we see in our profession. However, we do have some concerns because, as you said, and Representative Leverett, you mentioned, it's a lengthy bill, I think 63 pages from the original bill. And there are some things that relate to possibly upper payment limits, and then questions about the zoning policies, and a few things that we just have questions about that we really have not had an opportunity to get a poll from our membership to see where they stand on that. The code section that we haven't been able to, again, poll our membership on that to see about the position, but we really want to make sure that we have, wherever the regulatory and compliance of the EMS profession is, we just want to make sure that we are recognizing the fact that we are continuing to have ongoing issues with EMS, whether it's low reimbursement rates, whether it's response times. So probably a lot more of that is more evident these days than it has been in the past. And we would just like to continue the conversation to make sure that we're addressing all of the concerns and that we are not doing something that is going to open up something for an unintended consequence. Chairman McDonald, I did want to mention a little bit about what you referred to as far as the testing. Just for clarification on that right now, EMS providers in the state of Georgia actually test and are certified through the National Registry of EMTs. And that governing body actually provides for reciprocity. So as you know, we have paramedics, flight medics that actually operate not only in Georgia but in other states. And through Replica, which is the compact that was actually established that helps accommodate that, there are some of the things about reciprocity that I think that would also need to be discussed if we change to a different testing format to come to either some type of composite board where testing would be done in the state of Georgia. Mr. Chairman, I'd be glad to answer any questions if there are any.
Thank you very much. I'm going to recognize Representative Smith for a question.
Thank you, Mr. Chairman. You mentioned reimbursement rates. Will this new council set these new reimbursement rates? Do they have anything to do with that?
Not that I'm aware of, and what the language has been so far that I've seen. It does not, but those are just reimbursement rates for EMS right now, balance billing. Those are some of the issues that we are currently tackling, so those are just kind of front and center. But as far as I saw in the actual bill itself, that is not something that the board would actually be setting.
Follow, Mr. Chairman?
Yes. Yes.
Thank you. Is DPH currently responsible for setting rates?
Those reimbursement rates actually, and I'm going to probably, Jake Lonis is here also. Jake, were you going to provide comment? Yes. So Jake may want to address that also. The association, one of the things that makes, I guess, our profession a little bit more complicated is that we have a combination of public providers out there, public EMS and private. So all of those members, whether it is either a hospital-based service, a fire-based service, or a true county or a private service, we represent all of them in our some 4,000 members of our association. So the reimbursements that we're looking at now, there's different things I think that Jake would probably be able to address better from a private provider standpoint.
Thank you.
Okay.
Chairman, if I could also say that
Let me do this. Let me see if we have any more questions up here, and then I'm going to come back to you before we take another speaker and let you address any of those concerns. Do we have questions from members? We do not. Thank you for your testimony.
Okay, thank you, Mr. Chairman.
Chairman Leverett.
Just to say that the bill itself does not intend to impose any additional policy changes or fundamental changes. And I don't believe that it does. For example, I met this morning with some representatives of a private EMS service, and they had concerns about some of the language that was existing statutory language. It was not changes. And that sort of goes to a topic of the statute probably does need a bit of a scrubbing and updating, but I felt that I was already at 60 pages. I didn't want to stretch it out any further. That maybe is a bill for another day.
Thank you, sir. Okay, we're going to Jake Lonis.
Good afternoon, Mr. Chairman, Council. Thank you for having me. My name is Jake Lonis, and I work for Puckett EMS, which is part of the Priority Ambulance family. And I'm very honored to say that Priority Ambulance is the largest private ambulance company in the state of Georgia. Our 4 subsidiaries are Puckett EMS, National EMS, Central, as well as AmbuCare. And so we represent a good majority geographically of the state. So I appreciate the opportunity to make a comment. Chairman Leverett, thank you so much for bringing this up. I think it's very important. However, I do think the way we go about it is more important. I've been in EMS for 30 years, And things have changed a lot in EMS in 30 years. And I don't want to sit up here and be, doom and gloom, but EMS is a dying industry. We are in peril. And not just in the state of Georgia. Nationally, EMS is in peril. So many factors. I can elaborate on those if necessary. But I think this is a great starting point. But I feel we need to go about it properly. We need to have communication, obviously, partnership, collaboration. Some of the sections in the current bill act are outdated. And need to be revised. There is no question in my mind that needs to be tort reform for EMS. And so there's just so many challenges. So I may have just stepped on a landmine here, but I'll stop there and answer any questions you may have.
Thanks, sir. Members, do you have questions of Mr. Lonis? I see none. Thank you.
Thank you.
Whoa. Who's okay? Representative Smith.
Thank you. It's the same question that I proposed to your colleague about who sets the reimbursement rate currently, and if that will change with this new council.
Yes, sir. So if I may just ask a clarifying question, what reimbursement rate are you referring to? Okay.
It was mentioned. I'm just concerned, about the independence perhaps maybe that they already have with DPH versus.
Right. So DPH.
I could be ignorant.
No, sir, not at all. Just uninformed. The DPH does not set any rates whatsoever. The upper payment limit, there's an assessment tool that's used through the state, and it's fairly subsidized. And so that was one of our concerns, but Chairman Leverett assured us that was not the intent to change that. CMS, Center for Medical, for Medicare and Medicaid, they are probably one of the biggest payers for both public and private ambulance services. Those rates are set with the fee schedules every year. Yes, sir.
Thank you. Any further questions? I see none. Thank you for your testimony.
Thank you.
Chairman Levitt, I'm going to make this remark, and I think I'm well within my rights to do that. To the members of our committee. Chairman Leverett has developed a reputation for not only being very articulate, but very accurate and very trustworthy in the way he describes legislation. And for that reason, I personally would say to you, I feel very comfortable in taking his word that as far as he's been able to determine, we're not making any of those changes that some people are finding troublesome in the bill. And I agree that we probably need to come back and clean up a lot of this, but that's for another day. Having said all that, we're in a position to take a motion. Have a motion and a second, and I think we need to adopt this substitute, don't we? So, any discussion? Now a motion to adopt the substitute represented in LC 600331S. Do I have that motion? Representative Draper makes a motion. Is there a second? There's a second. Any discussion on that motion? I hear none. All those in favor of adopting the substitute will say aye. Those opposed, no. We move to the main question, and that is, do pass on House Bill 1446 by substitute. All those in favor will say aye. Those opposed, no. Your bill will be in the main committee at 2 o'clock, Chairman Leverett. Thank you for being
Mr.
here.
Chairman, I'll try to be on time next time.
Thank you.
Thank you, Member.
If there's nothing else from members, we stand adjourned.